One of them is what we call upper airway cough syndrome. It's because of the related to your sinuses, which are here, and some in the back, behind the nose. If sinuses becomes congested, engorged, or secretions accumulate in them, and the reason that can happen is because of allergies or because of infection, then the secretions drain in through your nose into the back of your throat and tickles your cords, vocal cords, and people cough because of that. That's one cause. The second cause is acid reflux. That's a very common cause. The acid, it increases in your body by eating certain kind of foods, or if you have peptic ulcer disease, and the food stimulate acid goes up into your airways. It can go, you can aspirate some of it, and also there's a vagus nerve which can be stimulated by the acid, and that can trigger cough. And the third commonest reason for cough is asthma. So these three reasons are 95% of the time they cause cough. Then there are around 5% of other things which can be, foreign bodies going into the airways. It could be cancer. It could be other diseases which are unusual. So if you can eliminate these things, you can find the cause for the cough. The other disease that I see in my practice is a lot of asthma. Asthma is very common. Asthma is a lot of time related to allergies and because of postnasal drip. And I see a lot of patients with COPD that consist of two diseases. One is emphysema and the other is chronic bronchitis related to smoking. These are what we call bread and butter for basket for pulmonary diseases.
So you mentioned smoking. That's a very big topic in the realm of pulmonary specialty. And why don't you tell us a little bit more about what smoking really does to your lungs and your breathing?
Smoking is probably the worst thing you can do to yourself. It's worse than using a lot of intoxicants. Smoking, when you smoke a lot of tar, the smoke that there is, and there are other toxins related to it which straight goes into your lungs. They can go into your sinuses also. Smoking also affects your heart. It also affects your gastrointestinal system, increases the risk for cancer in all organs, mostly in the lungs. Cigarette smoke damages the lung tissue itself, and it breaks down over time. It breaks down the lung tissue. It causes a condition called emphysema. It also inflames the breathing tubes, which are called bronchioles. If they're inflamed, and that is the swelling of the tubes, you develop asthma, you develop chronic bronchitis or acute bronchitis, and then the immune system goes down, you can develop pneumonia. So there are a number of things that cigarette smoking does. If we can eliminate cigarette smoking, we can eliminate majority of lung diseases.
A lot of people think that smoking shisha, which is now very popular among young people and old people alike, they think that shisha is less detrimental to your health than actual cigarette smoking. Is this true or not?
Very good question, Marok. In fact, shisha is as harmful or more harmful than cigarette smoking. It has a lot of toxins. Smoke is there. People say it's coming through the water, so it's not as bad, but it is. There have been a number of studies that have been done and seen that it is more detrimental at times because the amount of smoke that you're inhaling is in much larger quantities than cigarette. So I know this is a misconcept which is present, and I've seen children smoke in front of their parents because they think it's cool and it's not going to cause any harm, and the parents believe that it's fine. It's easy, it's simple, it's cool, whatever. But it's long term, these children who are smoking shisha these days will have severe lung diseases. Also, not even lung diseases, ordinary lung diseases, lung cancer. So be careful. We need to spread the word out that shisha is not good. It's not. It may be hip right now, but later on, people will regret. I have patients who are 80 or 90-year-old, or even 70. When they were young, it used to be hip to smoke, and everybody smoked. And now they come and tell me that we wish that somebody would have told us that smoking is going to cause such harm, because a lot of them can't even walk 10 steps. A lot of them have tracheostomies. Tracheostomy is a hole that is done in the neck, and they put a tube in so they can breathe. It's a bad disease. Lung disease is a bad disease to have, especially emphysema, COPD, or cancer. And unfortunately, a lot of smokers these days who smoke cigarettes or smoke shisha will have lung diseases in 15, 20 years.
Obviously, quitting is probably the best way to take care of your lungs if you're a smoker. What are some of the other good ways that you can keep your lungs healthy?
In fact, coming to quitting, that's important. It's one of the most difficult things to do, to quit smoking. It's highly encouraged, but it's a bad addiction. It's one of the worst addictions you can have. There are a few ways to quit smoking. One is cold turkey, that is, you just decide, but you have to believe that, yes, I'm ready. I want to quit, and say, okay, tomorrow I'm not going to smoke. And a lot of people succeed in that, but not everybody, because of the addiction factor. So they pick up one cigarette or one puff and they're back, they're smoking. There are other things that are available to quit, like medications. We have nicotine patches, nicotine gums. There are certain other medications that are available. They're called Chantix or Zyban. They do help in decreasing the amount of cigarette smoking or quitting. But nothing is as important as the person, him or herself. They need to be ready to quit. The other things to stay healthy, that's what you asked me. Right. Basically, good environment, clean environment, stay away from toxins, pollution, don't live near a freeway or an airport. Away, if you're working in a factory, you make sure you use enough protective gear, masks, or other protective material that is available to you. Exercise in a good open environment, which keeps your lungs healthy. And naturally eating well and keeping your immune system in good shape.
Now, some people, obviously you said that some of your patients come in with a cough. A lot of people have just trouble breathing. What could that be, and what can people do on their own to take better care of their lungs?
In fact, people who just have shortness of breath, there's something going wrong with them. This means that either they have asthma, or if they have developed emphysema or chronic bronchitis. If not that, just shortness of breath could be because of heart problems also, especially elderly. If the heart is not pumping properly, it can back up and cause fluid retention in the lungs. It's called congestive heart failure, or fluid collection in the sac of the lungs, which is called pleural effusion, which restricts the lungs, and patients can develop shortness of breath. The other reasons could be deconditioning. If you're very obese, you cannot move if you don't do exercise regularly, lying down in the bed all the time. Naturally, deconditioning is one of the worst things that you can do to your body, emotionally and physically. So highly encourage you to do exercise, stay